Hello and welcome to episode number 10 of October Surprise, a podcast created for citizens by citizens in Pennsylvania's new 16th Congressional District. I'm Jim Roddy, a lifelong resident of Northwest Pennsylvania, and your host for today's podcast. A little bit of background on our podcast. October Surprise features a series of interviews designed to educate listeners in Erie, Crawford, Mercer, Lawrence, and Butler Counties on key issues that face both our district and our two congressional candidates, incumbent Mike Kelly and challenger Ron DiNicola. Each podcast will also discuss ethical leadership, which unfortunately is in rare supply in Washington, D.C. in 2018. We'll do a lot of talking today and throughout the month of October on this podcast, but our ultimate goal is action. For democracy to work, you have to participate. We can't be bystanders. So at a minimum, that means being an informed voter. You can help by sharing episodes of October Surprise with your family and at least one or two friends. You know, those on-the-fence voters, maybe they vote in midterms, maybe they don't, the folks who live in our district. The ultimate action is to vote on Election Day. Let's surprise the special interest groups, the political action committees, and the big money when we take back our district on Tuesday, November 6th, and once again, put people first. Finally, I'm not a political veteran or a campaign strategist. I don't have all the answers, and a lot of people think neither do they. But together, we're going to learn what's happening in our district by talking with elected officials, grassroots leaders, and extraordinary citizens from PA 16 in each episode. Our special guest today is Dr. Joe Talarico. He's an Erie native, graduated from Cathedral Prep, class of 1972. He lives in Zelienople in Butler County and currently commutes to Bedford, where he works as an anesthesiologist. He's been in practice for 38 years. He's also a member of the Western Pennsylvania Coalition for Single-Payer Healthcare, and he's a board member of Healthcare for All PA. Dr. Talarico, thanks for your time today. Welcome to October Surprise.
Well, nice to be with you, Jim.
Great, and so this is one of two episodes that we will be launching today on October Surprise. This is episode number 10. We're going to get a doctor's perspective on healthcare. We're also releasing today episode number 11, where we talk with Brian Skibo of Hermitage, who is a brain cancer patient, and so we'll get a patient's perspective as well. So let me ask you first, from a doctor's perspective. So folks know doctors make good money in our current healthcare system. The system works well for them. So why are you an advocate for changes in our current healthcare system? A lot of folks are just let things be how they are. Why do you want to make some changes to the system?
Well, you know, I wasn't always a doctor. I grew up working class and probably really close to working poor. And over the years, I've seen so many people that were in that situation that just don't have the access to health care. And, you know, in this country, we like to say that we have the best health care in the world, which we don't. Although if you're fairly wealthy and insured, you could make an argument that you do have the best health care in the world. But the whole system, it doesn't apply for the whole system because there's so many people left out. And I've just run into so many people that have, you know, had bad diseases, or even not even really bad diseases, just chronic diseases that were not able to afford their health care, their medications, and I just don't think that's right.
Got it. So you just touched on that, and that's what I'm curious to hear about your firsthand perspective working with patients. So you just mentioned about citizens don't have access to affordable health care. We also hear stories of medical emergencies forcing families into financial crises. So from what you see, is that all real? Is it overstated? Or is it potentially even understated? What are you seeing from patients?
To be honest with you, I think it's understated.
Okay. And why do you say that?
Let me use myself as an example. Over the years, we've had some minor chronic diseases in the family that really weren't any big problems, but they were diseases that cost a lot of money, and we had a lot of uncovered medical expenses. You know, for me, that's not a big problem. I mean, I've had as much as $15,000 to $20,000 a year in uncovered expenses. And again, like I said, for me, that's not a huge problem. Mm-hmm. But you know, if I was a guy supporting a family of four on $40,000 a year, my family would have gone without a lot of that care because we'd have to decide whether we got the medical care or whether we ate. And I just don't think that's right.
Yeah, and that kind of gets down to the moral part of this, where, like you said, $40,000 a year, is one thing. But if you're making, I'm even going to do the math here, 10 hours or $10 an hour times 40 hours a week times 52 weeks a year, that's only $20,000 if you're making $10 an hour. So is that part of why you're active in this regard? Is because folks just can't afford to get the health care they need?
Absolutely. Especially diabetics. I mean, diabetics, they have this $250 insulin vial, that if you're making the $20,000, you're uninsured or underinsured, you're not going to buy that insulin. And these people are dying young. They're getting they're going blind. They're getting kidney failure. It's just not a good situation for at least 25% of the people in the country, and probably, including the underinsured and the inadequately insured, probably 50% of the country at least.
Well, when you say underinsured or inadequately insured, what do you mean by that? And again, so I'll speak from my personal perspective. When I was self-employed, I was underinsured, and then I had insurance, but I'm not sure what all that covered. But for the last, 20-something years, I've worked for companies that provide full health care coverage for me. So what do you mean when you say underinsured?
Well, underinsured, I think, has expanded a lot over recent years because, with companies that are cutting back on medical care, not cutting it out, but cutting back on medical care. It's not uncommon at all to have $3,000 to $5,000 out of pocket, between deductibles, co-pays. That's not uncommon at all to have $5,000 out of pocket costs. And again, for the guy making $10 an hour, that just doesn't cut it.
Yeah. Okay.
And so those people are inadequately insured. I mean, they probably aren't technically underinsured, but they're certainly inadequately insured.
I see. So the gap in order for them to get the health care coverage that they need, even if something covers half of it or two-thirds of it or something like that, that remaining third is just too much of a burden for them. And so they'll either, like you said, have to really, really difficult choices to make. And oftentimes the choice is that they just won't get the health care that they need.
And sometimes, it's elective care that the lack of that will lead to major problems down the road. And the perfect example, my last job at Presby in Pittsburgh was as a GI anesthesiologist. I was doing a lot of colonoscopies.
Okay.
Colonoscopy, that's an expensive procedure. It's probably $2,000 by the time you get out the door, and probably more. But again, if you have insurance, that's not a big problem because the insurance takes care of most of it for most people. But the people that don't have the insurance or don't have coverage for that, they just don't get the colonoscopy because, let's face it, on a day-to-day basis, it's just not that important to them. And I'm not calling that a bad decision. I think it's a good decision, whether you get your colonoscopy or whether you feed your kid. And what happens is 10 years down the road, they have a colon tumor, colon cancer, and they die from something that if they would have found it 5-10 years before, they would have cut out a polyp and left the hospital, an hour later.
And it's interesting you bring that up. So you and I only had a brief conversation before we hopped on the phone here. So yesterday I had a colonoscopy. So I was out all day, I guess the day before doing the prep and all that. If anybody's not familiar with the prep for colonoscopy, go search it on your own. I'm not going to describe it for you. It's rather painful. But I'm 48. When I was 32, I was diagnosed with colon cancer. And, through a colonoscopy that I had, actually because I was insured, I was going and getting regular checkups, and my blood work said that something was wrong, so we, dug into it further. But being in my 30s, if I didn't have health care, if I had to pay for that out of pocket, I would not have gone. I mean, because why would I? I was healthy. I was active. I don't smoke. I rarely drink. I exercise. I'm not overweight. I feel good. I never would have checked that out. And that's what I think you're kind of referring to. And the sign yesterday when I was getting the colonoscopy said about how thousands of people die every year from colon cancer, but it is one of the most treatable, most preventable diseases if you catch it early. But people just don't take the time to go do that. Don't take the time and don't have the means to go do that. I'm just very fortunate I had the means. If I did not have health insurance, I would not have checked. I would not be alive today because there was there was a mass, there was a tumor in my colon.
And there's so many people that fit that to a T.
Yeah.
It's really a shame.
Yeah, it really is. It really is, and that gets into some of the morality of it. One thing that folks talk about is, hey, I know this all sounds good that everybody gets health insurance coverage, but that's too much of a burden on the business community. And so in episode number 3 for October Surprise, we talked to Erie healthcare advocate Cindy Purvis, who focused not just on talking about the patients who'd be covered by a new healthcare system, but also the business community. And so she said a new system she thought would save small businesses money on healthcare. And I can say as a former business owner and a business manager, we saw that healthcare was, rising by double digits, sometimes significantly high double digits every year. So what's your perspective, Dr. Talarico, on the healthcare burden that businesses are facing today, and what can be done to alleviate that burden?
Well, actually, the Pennsylvania plan, and I'm sure Cindy talked to you about that, would really be a boon to the small businesses, that, especially the ones that provide health insurances now, because what that would involve, it would involve first dollar cradle to grave coverage for everybody, and it would be 10% employer tax and a 3% employee tax. Now, that sounds like a lot until you realize that most employers are paying well over 10% of salaries for healthcare right now. So that would go away totally. Not only would that go away, but also all the extra expenses, the thousands of dollars that people have to pay out of their own pockets every year for healthcare. And that does a couple of things. That does a couple of things that are very beneficial for business. If people have money, people have more business, and the working people, would have more money. And I'm sure that in time that any cost of that insurance would be more than taken care of by the increase in business. When all of a sudden your customer base increases by 30%, that's big. The other thing, I lost my train of thought here.
That's all right. No worries at all. Well, let me ask you this. So you mentioned about how this could be a boon to businesses, just that there'd be more money for people to spend from an economic standpoint. But we hear so much. I remember it was job killing Obamacare, the job killer. And so it's interesting because now we've had 100-something straight months of job growth. And you've had Obamacare for almost 8 years now, somewhere in that regard. So
yeah.
I guess that's like the reality doesn't match the rhetoric is what it seems, and it could even be better, is what you're saying, with a different healthcare plan, an improved healthcare plan.
Yeah, Obamacare was a step in the right direction.
Mm-hmm.
It was certainly inadequate for a lot of people. One thing that it did do is it brought a lot of people, millions, that had no health care at all, and it brought them into the system, and it got them access to what is potentially the best health care in the world. What it didn't do was it didn't take care of the underinsured and the inadequately insured, as I spoke of before, because a lot of the plans really don't cover. Well, they cover everything, but they don't cover the deductibles and the copays. Now, and the other big advantage to Obamacare was the big expansion in Medicaid. So millions of people that weren't covered before are covered now.
Yeah.
What it didn't do, it didn't take care of the problem of the people that are insured and still spending an inordinate amount of their own salaries for health care. And we have to do something about that.
Right.
So that, when I lost my train of thought, the other thing that it does for patients is that it gets them to the doctor quicker. And, in countries where they have first dollar health care, patients, for example, Japan, I think the average person sees his or her doctor 13 times a year.
Wow.
In the United States, it's 1 or 2.
Yeah.
Now, if you look at that, you say, oh, that's expensive, but it's not expensive because they're spending less per capita, much less per capita for healthcare for better outcomes than we are, because people are getting their colonoscopies and people are seeing their doctor when, with minor symptoms before they become major. And overall, it's saving money for the system.
Exactly. This is very much a thing of if you spend the money, you'll spend a little bit on the front side, or you'll spend a ton later. I think that was an old car muffler commercial or something, or transmission commercial. Like, you can pay me a little now or pay me a lot later, and that really describes their healthcare system. Now, Dr. Talarico, you were talking about, hey, here are some ways that I would improve our current healthcare system. But what's been happening in our current Congress, they've actually tried to reduce benefits, and which is going to turn out to increase costs. And so Mike Kelly, who's our current rep for PA 16, he was among those who voted to raise health care costs on workers in rural districts and remove pre-existing conditions. And folks are like, oh, what are you talking about for pre-existing conditions? Here's some examples. Alzheimer's, asthma, cancer, cerebral palsy, diabetes, dialysis, MS, organ transplants, Parkinson's, pregnancy, and sleep apnea. And so that just seems like on the surface, again, for me, I'm a layperson. My involvement in the medical community is what I told you about, like just jumping in yesterday as a patient. But it seems like it wouldn't be an understatement, or it wouldn't be an overstatement, that if Mike Kelly gets reelected, his party controls Congress, and they get their way, you could have thousands of men, women, and children in PA 16 who lose their coverage. Fewer people than are covered today, and you're talking about how can we get more people covered. Again, am I overstating that, or what's your take on that?
No, actually, you're not overstating that, and you have to understand where Mike Kelly's coming from. He's a multimillionaire. He's one of the most wealthy members of Congress. And you know what? If he lost his coverage, say, for a liver transplant, which he won't because he'll have government-paid insurance, and they'll continue to cover that. But if he lost his coverage for a liver transplant, he could buy a liver transplant. Now, there's probably only less than 1% of the people in the country that could do that, but Mike's one of them that could do that.
Yeah.
So, I mean, what does Mike care? And it's obvious whenever you see the guy talk that he just plain doesn't care.
And why do you say that? What makes you say that he doesn't care?
He keeps. I mean, he's still a big proponent of the tax cuts for the wealthy people, welfare for business, because he's a car dealer and a lot of his money comes from oil, subsidies for oil companies, all that stuff he thinks is great. But you know what? Food stamps? No. Medicaid? I mean, he was against Medicaid expansion, he was against Medicaid expansion nationwide because he's federal. But every time you see Mike Kelly talk, he tries to tell you he's for the working people, but let's face it, he's not.
Yeah, his campaign commercial says he's one of us. So, when folks hear about changes to healthcare and some of the things, healthcare for all, it's like, ooh, socialism, socialized medicine, government-run healthcare. Remember, what was it 10 years ago? Death panels people are talking about. How do you respond when you hear pushback to changing our current healthcare system where people say, we wouldn't want to be like Canada, we don't want to be like these other companies, and those horror stories? How do you respond to folks like that? Again, with you being on the inside of the healthcare system, you have insight into this. What do you say to folks who are thinking?
Well, in spite of the fact that I think that our resources are arguably at least as good as Canada's, and most likely a little bit better. But in spite of that fact, Canadians are healthier, they live longer, and they have about, I think, 30% less per capita healthcare costs. So basically what they're doing is they're doing more with less. And they're doing it under, it's not really a socialized system, but they're doing it under a semi-socialized system. And, when people start talking about socialism, people, they're still using that word, as a fear tactic. When most people, unfortunately, talk about socialism, they're talking about the Soviet Union, Cuba, and these are not socialist countries. These are countries where basically the government has taken over the spot of the plutocrats. Basically instead of the business owners, the government is making all the money, and the workers are still exploited, probably just as much as they are here. In some cases, even more.
Yeah.
This is not socialism. So real socialism is from the ground up. In a real socialist system, for example, in the workplace, the workers would have at least an equal say, and maybe more say than the owners in what's produced, how it's produced, how people are paid, all that kind of thing. So basically, when you talk about socialism, you're talking about things like, first of all, labor unions. They're relatively socialist organizations, and they're not killing people. And people that work for people that are under a labor union do a lot better than people that aren't. If fire departments,
right,
military, police departments, they're all socialist organizations. So people have to understand that socialism is not necessarily a bad thing.
Yeah, it just, you have to dig into the details, again, beyond the sound bites. And again, that's kind of why we started this entire podcast, where, if we had a system that had, where you couldn't own a business, like you said, the government owned the business, everybody made the exact same, well, and everything fed, the government, that would be a bad thing. But I, drove into my office this morning, not on my own road, a road that somebody else, laid down for me on an electrical system that, I didn't put together myself. There are appropriate times when we should pull resources. And I guess, are you seeing, when you look across the entire world and you study this healthcare thing, there are other countries who are doing this and doing it well, like you mentioned those stats from Canada. But it seems like we pull our resources here in the United States on some things, but when it comes to healthcare, like, no, we're not going to do that. Is it the big money, you think, that's behind it? A lot of those pharma companies, a lot of those, big healthcare companies that have a lot of money, where they don't want their world rocked. Do you think that's why it isn't happening in the United States? Is that one of the reasons?
Absolutely.
Okay.
Absolutely. And to a lesser extent, the hospital systems have to take some responsibility too. They're basically in the same game, and to a lesser extent, the doctors. Let's face it. Even a very moral, very good person, if they have two choices and one's going to make them an extra dollar, they're going to choose the one that's going to make them an extra dollar. All other things being equal. I've been doing this for 38 years, and up until recently, I never had one incentive, and most of that time I've been working for somebody else. I've been working for UPMC, and up until recently I've never had any incentive that didn't involve more care and more expensive care. And they're not the big culprits compared to pharma and the insurance industry. The insurance industry, basically, they're in the business of collecting premiums and paying out as little as possible. And that doesn't necessarily mean, it doesn't mean at all refusing unnecessary care. It means refusing necessary care because it helps their bottom line. Now with the drug companies, and as an anesthesiologist who works in critical care medicine, I see this firsthand on a day-to-day basis. We have, for the past at least 5 to probably 10 years, we've had periodical shortages of critical care medicines, things that save people's lives. And the one thing that all these shortages have in common, they're all old drugs that are very cheap, and they're not making a lot of money by producing them. So what they're doing is they're diverting their resources to, developing the new antidepressant, the new anti-cholesterol pill, that they make a lot of money on, and they're just not producing enough of the. One perfect example is a drug called norepinephrine, that when somebody's in shock, and they run them on a drip to keep their blood pressure up until they can recover enough that that they can get them off. And without that drug, they die. And we've had critical shortages of drugs like that. And again, it's because they can't make enough money on that drug to make it worth their while to divert some of their resources. That's how capitalism just doesn't work for necessities. It just doesn't. Because let's face it, the goal of capitalism is to maximize profit. That's every incentive they have is maximizing profit.
Yes, and capitalism works in a lot of different ways, but it seems like it works in the healthcare industry for a heck of a lot of people. But what you're talking about is those lower-income folks, the poorer folks. Now it's even creeping up into the middle class from that standpoint. It seems like our current system doesn't work for them. Like maybe everybody listening to this podcast, like me in particular, the healthcare system has pretty much worked well for me because I've been employed with somebody who offers great health insurance. But you're talking about the giant gap of our fellow Americans, millions of people who are suffering and not getting the care that they need.
Right.
And so we got on this point talking about the big money behind it, and some people might be listening to this and going, well, what are we going to do in PA 16? What can we do in Erie or Butler about this? But just a little bit of background on Mike Kelly and his influence by these industries. So OpenSecrets.org, which is the website for the Center for Responsive Government, reports in 2017-2018, Kelly received over $150,000 from the insurance industry. So mostly insurance political action committees received $73K from pharmaceutical healthcare PACs, $55K from health professionals. So that's over $250,000. So, I mean, is that part of why you see, you said if somebody's going to get $1, it's going to lean them in that direction. Well, you get $250,000, now you're really going to lean in that direction. Is the influence of, these organizations in our politics, is that part of the reason as well why you don't see America moving forward in the interest of its citizens as opposed to in the interest of the special interest groups?
Oh, absolutely. I mean, these companies aren't giving him this money because they love Mike Kelly. They're looking for return on investment, and this is probably among the best returns on investment that they get. And actually, I didn't mention this before, but I was kind of peripherally in that game before. I was the president of the Pennsylvania Society of Anesthesiologists probably about 8 years ago, and on a much smaller scale. But we used to do the same thing. We used to go in, every year we'd have our legislative conference, and we'd go talk to our Congress people, in the interest of patient care. And granted, some of it was for improved patient care, but let's face it, some of it was for improved income for us. And, my group spent millions of dollars nationally on this. And again, we were small potatoes compared to insurance companies, oil companies, defense industry. We were nothing compared to them. But we put a lot of money in, and basically I've probably talked to every congressperson in the 16th, for the last not so much recently, but over the last 15 years before that, where the average person doesn't get that access.
Right. Right. I have a colleague. I work in the IT industry, and we're part of a nonprofit association, and people are talking about, this association that provides all sorts of services to its members. Should it do government lobbying? And people were debating that, and this person said, I hate to break everybody's hearts, but let me tell you how it works. If you're not a donor, significant donor, they are not going to sit down and meet with you. So all this talk of, let's make the case, let's write some letters. I'm sorry, but the reality is, unless you donate to them, they are not going to give you the time of day. And that's what you're saying is kind of the reality of it. That's how you got access, is you buy access.
Yeah.
So, if we've talked to somebody, people might be like, boy, this is, really depressing, this conversation about from a healthcare standpoint. But let's talk about going forward. So can you talk about why you're supporting Kelly's opponent, Ron DiNicola? And so I don't know if you and Ron see eye to eye 100% on the same healthcare program, but what I understand is you're in lockstep that healthcare is a right for every American, and plus he's not accepting corporate PAC money, so he's not in the pocket of this, healthcare special interest groups. Can you talk about why you're supporting him and what you hope he does going forward to help provide health care for all in PA 16?
Well, Ron's not quite where I want him to be. But that's okay. He's a whole lot closer to where I want him to be than Mike Kelly is, and a whole lot closer than Mike Kelly ever will be. And I am confident that we can help him evolve a little bit. Ron, I think I'm pretty sure wants to expand Obamacare, which is not a bad thing. It's not enough, but it's not a bad thing. But the other thing with Ron is he was active in politics, 15 years ago or so.
Yeah, 20 years ago he ran, yeah.
Yeah. And it was different. It was a different time back then. And then he kind of did his own thing with his legal career, and he was really out of it. So he hasn't seen the evolution of healthcare, or at least of healthcare groups like ours, that really we're in our infancy. Ron's in a pretty big pot with people that just aren't quite where we are with it, especially the politicians. The people seem to be there. If you ask them, specific directed questions about how they want their health care, they seem to be more with us. But I think that at least Ron is a person that will have his ear, and he's close. He's not where I want him to be, but he's close.
Yeah. So can you talk to the folks who are listening to this who are still in search of the perfect candidate, and they're saying like, well, he's not the perfect candidate, so I'm going to hold out for the perfect candidate. I guess what would you say to them, if they're an on-the-fence voter in that regard? Because it sounds like you're saying, hey, it's not what I view as perfect, but it's certainly closer to where I want it to be. Would you encourage that person to, vote for the person who's closest to them and not hold out for the person who's perfect in their mindset?
Absolutely. And I think what we have to do is we have to vote for the person that's closest to our own, to our own ideology as possible. And then once that person gets in, we have to push that person further. Nothing happens if we don't continue to push. Roosevelt would have never done the New Deal if the people didn't make him do it. He actually came into government, or he came into the presidency, promising to cut expenses and balance the budget. He soon learned that under the conditions he was in, that wasn't going to work, and the people pushed him to start the New Deal. And look what that's done for people over 75 years until the Reagan counter-revolution.
Right. Yeah. Interesting. You bring up, past presidents and the New Deal and all that, where people think they just walked in and flipped the light switch and made that change. Now, there's the influence of the people speaking up and doing that and moving one or two steps at a time in that direction. The analogy I use is, we're living in Western Pennsylvania. If you want your candidate to be in Denver, Colorado, and the only two you have to choose from, one's going to Chicago, one's going to Boston, choose the one who's going to Chicago, because that's going to get you way, way closer as opposed to all the backtracking that you're going to have to be doing. So, holding out for that perfect candidate, you just won't end up voting unless you run yourself, and then no one will vote for you.
Yeah. And in the last election, we see what not voting did. Mm-hmm. And I'm not blaming the people who didn't vote, because I think that a lot of them had a very good reason not to vote. They weren't given a good choice, but certainly they were given one better choice. and it's really panned out. That would have been a whole lot better of a choice than what we have now.
Right. Well, that's all the time that we have. Dr. Talarico, thank you so much for your time today and giving us insights. And again, I can say from personal experience in the last 24 hours, thank you for being a good anesthesiologist, because without good anesthesiology, it's going to be a whole lot more painful for folks. And like I said, yesterday was I just went in and took a nap and had a fine time. So I appreciate your insights. And again, thanks for all that you do.
Thank you. Been my pleasure.
Our podcast today is over, but there's still more that we need to do. As we talked about at the start, for democracy to work, we can't be bystanders. We have to participate. You can help, again, by sharing this episode with your family and some of those on-the-fence voters who live in our district, and then by voting on Election Day. Let's surprise those special interest groups, the political action committees, and the big money when we take back our district on Tuesday, November 6th, and once again, put people first. I'm Jim Roddy. Thanks for listening to October Surprise.